Good evening, dear friends. Today I welcome you in the company of S, as you may have already noticed, with the hip joint. Haven't you ever wondered why this joint is one of the most commonly replaced joints? Why is hip joint replacement so widespread? Why, unlike other joints, does it not withstand the load? Why does it hurt? And why does hip joint osteoarthritis develop so often? And how can we avoid it together? Today, we are concerned with this question together, and we must prevent this whole process. And even if you already have arthrosis, well, of course, if it's not at such a stage that it's time to replace the joint, we will also successfully relieve the condition today. Well, what if you don't have it yet? Or if you have first-degree arthrosis, when it's just a narrowing of the joint space, thinning of the cartilage, that's all it is. When it's first degree, you can practically bring your hip joint to a perfect condition. And you can also get rid of the pain, so that we can understand why it hurts, what exactly hurts there, and what is hurting inside it. When there is no arthrosis yet, we need to figure out what moves it, which muscles make the hip joint move, and where the weakest spot is that causes it to start getting injured. The joint is capable of making a variety of movements. You can rotate and twist your leg because of the different combinations of muscles that contract and move it. The main muscle groups. The first one is on the front surface of the thigh. We have the rectus femoris muscle, which is part of the quadriceps muscle group, together with the iliopsoas muscle, which is also one of the strongest stabilizers of the lumbar spine. Together, these two muscles flex the leg at the hip joint, bringing the leg forward during walking. They also participate in bending movements. In all actions where you bend forward, movement also occurs there. Here are two main muscles. The lumbar part of the iliopsoas, the iliopsoas we can say, and the quadriceps femoris, the straight muscle of the thigh, which is part of the quadriceps. Two muscles that make the movement forward. Next, the movement backward, the opposite movement. What moves backward? The gluteus maximus is a powerful muscle that also participates in bending. Without the gluteus maximus, it would be difficult to bend over. The load would be too much on the lower back. And if they're not capable, if your gluteus maximus is weak, the extensors of your back, which include the erector spinae, the iliocostalis muscle, and the quadratus lumborum, are not able to handle such a load. Without the gluteus maximus, your back will hurt. Next, what else does it do? Moving backward, like this? In the hip joint, the reverse movement, forward, is done by the muscles on the back of the thigh. The biceps femoris, a powerful muscle, the biceps muscle of the thigh. Just like in the arm, it turns out you have one here too. And next to it is the biceps. It's a little bit here on the outside and here on the inside. The semitendinosus and semimembranosus muscles assist the gluteus in backward movement. In addition, under the gluteus muscle, there is also the piriformis muscle, which to some extent can compensate for the weakness of the gluteus maximus. It often gets tense when the gluteus maximus is weak and compresses the nerve further along. And this will also be important for us today. It also starts to compress the superior and inferior gluteal nerves, which innervate the gluteus maximus and gluteus medius muscles. So the next movement is a movement to the side, like this, and the reverse movement. Let's start with the reverse movement. This is the movement to the side. This is called hip abduction, and this is called adduction. Not adduction like in the sense of a supernatural force, but adduction means to bring something. It's not from the word appeared, but from the word to bring someone somewhere. This leg is brought toward the center, right here, and we have a large group of muscles here, the hip adductors. There are several very powerful muscles here. If one weakens, another can still function. And everywhere we've just been with you, there's movement forward and movement backward. In adduction, we have several muscles there that work together, and if one is weak, another can compensate. But it's exactly the movement to the side. This is abduction of the leg to the side, you see? Here, only one muscle works. The main muscle that performs this movement is the gluteus medius. This is exactly when you get injections. If you've ever had an intramuscular injection in your life, that's exactly where they do it. Is this called the outer upper quadrant? In medicine, there are different terms for shapes, a square and a quadrant. The origin of the term quadrant is unclear, but it is the correct term used in the field. And they injected you right into the gluteus medius muscle. And this gluteus medius muscle is the only one that performs this movement. Of course, next to it is also the tensor fasciae latae muscle. But it's so small, so thin, just a few grams. I don't know, maybe 100 or 200 grams at most. Inside it, the gluteus medius muscle is powerful, and then there's the tensor fasciae muscle. It won't be able to move your leg out to the side. Even if you train it really hard, it won't work. It's a good movement, but it will hurt. So, as you've already guessed, the main weak spot is exactly the gluteus medius muscle. It occupies this entire area for you, this whole lateral surface. When it's weak, right here, a kind of hollow forms between the muscles. In real life, of course, it's rare. This movement, who actually does it, right, out to the side like this? We don't really use this movement much in everyday life, but how does it work for us in motion? In general, where is it actually used? So, at the moment when we are standing on one leg, when we walk, there is a moment when we end up on one leg, or the weight, practically, about 90% of it, ends up on one leg. At this moment, the gluteus medius muscle holds our pelvis and doesn't let it drop like this. If my gluteus medius muscle is weak, then the pelvis will drop to the side here. It won't be able to hold it, this muscle. So, at this moment, the moment when my leg moves forward, the gluteus medius muscle holds me, and that's where the main effort is focused. If it can't handle this load, then the joint starts to get injured, the pelvis starts to make this bad movement relative to the head of the femur, the joint surfaces get closer together, and then one cartilage, the cartilage of the acetabulum, starts to rub against the cartilage of the femoral head. Over time, various bone growths can appear here. The cartilage itself can become deformed, and it gets thinner. To prevent this from happening, the first thing we need to do is keep the gluteus medius muscle in good condition. And if there is arthrosis, then, accordingly, in 99% of cases, this muscle is absent. Even those who later have a hip joint replacement, their muscles rarely recover on their own. They require training and rehabilitation. Why does it weaken? What causes this to happen? The most common reason is, well, first of all, damage to the muscle itself. That is, against the background of its weakness, it's already weak and is rarely used in daily life. For example, you ran too much, walked too much, injured it, it became inflamed. Sometimes the tendon gets inflamed, sometimes the muscle itself is injured. This is usually where the injury happens. After that, it doesn't recover well and becomes weaker. In second place is impaired innervation. Here, a nerve approaches a certain muscle. If this nerve is pinched, the impulse won't reach the muscle properly. It will also start to weaken. Here we have the well-known piriformis muscle, which is located under the gluteus maximus muscle. It covers all of this from above. And under this piriformis muscle, two nerves pass through. One is called the superior gluteal nerve, which goes to the gluteus medius muscle, and the other is the inferior gluteal nerve, which goes to the gluteus maximus muscle. And with excessive tension or shortening of the piriformis muscle, one or sometimes both nerves can be compressed. The nerve is compressed. The impulse doesn't reach the muscle. The muscle loses tone, gets injured, or doesn't contract at all. But what should you do when it comes to the gluteal muscles? Does the body have to somehow look for a way out? So, in order to keep the pelvis stable, when this muscle here isn't working, the quadratus lumborum on the opposite side starts to overwork. That is, here it's weak, but the pelvis can still be held by the opposite side. These two muscles here, this is the quadratus lumborum, partially the iliopsoas, and a little bit of the oblique muscles, both external and internal together. If they tense up, they can hold the pelvis. But even so, there will still be a bit of excessive lifting of the pelvis in this direction. That is, it won't stay in the right position, and your leg will start moving together with the pelvis, which will cause even more trauma to the hip joint. Because during a step on the supporting leg, you will have this kind of rotation. The pelvis will rotate, that is, you will be standing, and during the step, your leg, you could say, is healthy on the side where the gluteus medius muscles seem to be working. But due to excessive tension in these lateral muscles, the quadratus lumborum, the oblique abdominal muscles, when the leg moves forward, it will shift together with the pelvis like this. And on the supporting leg, you will constantly be turning on the pelvis. And given that the two joint surfaces of the pelvis are already too close together, it will be like you're constantly scraping and scratching along the head of the femur, and the cartilage will wear down. So, what should you do? First, restore the gluteus medius muscle, and just in case, eliminate the shortening of the piriformis muscle so that there is no compression of the gluteal nerve. So, the first thing we need to do is work on the piriformis muscle with you. For this, it's good to use various spherical devices like a ball. You can use a tennis ball or special massage devices like that. You place the ball on the area of the piriformis muscle and lie down on it. You can also do this while standing. You can do it lying down or standing. That is, you place it right here. Go over the entire gluteal muscle just in case. You will find many painful spots there. Work through both the piriformis muscle and the gluteus medius muscle. Do all of this together. Lying down is an option. Here's how to do it. Now place it under the gluteal muscle, to the side of the sacrum. Everyone is lying down. Dream. Think. Reflect. So that your brain doesn't stay idle either. At this moment, you keep it occupied with something. Don't just stare at the ceiling, waiting for that painful spot you're pressing on to relax a little. Then you place the ball on another spot and wait as well. The pain can be quite strong. If it hurts a lot, reduce the pressure. You can bend your leg or keep it straight, depending on how painful it is. There shouldn't be severe pain. If, while you are working on this muscle, you feel that your leg is going numb, there's nothing to worry about. It just means that your muscle is quite short, and when you press on it, your sciatic nerve also starts to get compressed. So just stop at that moment and move to another spot, shift the ball. The second option is that you can do this with the help of a wall. So you stand between the wall and your gluteal muscle, place the ball, and now you can do it while moving. You just roll it side to side like this. You see, it moves back and forth. You work this area just like that right here, so you press through everything, all of it. The piriformis muscle goes from here to here. This is the way it runs. From the sacrum to the greater trochanter of the femur. Next is the gluteus medius muscle, the lateral part. This one right here, it can be quite painful. Do you also work around the wall? Initially, it's best to practice standing near a wall instead of lying down. Like this, you place yourself near the wall, stand up, and do it this way in motion. Or you can just do it without any movement. You found a painful spot. Held on it for a while. In the front part, here are the hips. the front part of the hip joint area. Right where you have this little bone, that's the anterior superior iliac spine. In this part is the muscle called the tensor fasciae lati. It is also often very painful when the gluteus medius muscle is weak. And you can also work it out in this way. Some people even think that this pain, which it causes due to its overstrain, and it gets tense because the gluteus medius muscle is weak. Somehow, you need to lift your leg at least a little. This pain, to many people, seems like it's actually the joint that hurts, but in reality, it's just a muscle spasm. So, if you work it out well here, this pain goes away, which means it wasn't the joint that was hurting. And that's good. So we've also worked on the gluteus medius muscle from both sides. There are two options. If you press the painful spot hard enough, it hurts. You find it, press it, hold for a minute, then move on to the next one, and that's how you work through them. If nothing is particularly painful, you can just do it in motion. Here's the ball, and you move a little to the right, a little to the left, just like this, shifting around, working through the whole area. After this, you can already start training your gluteus medius muscle. But of course, you can also stretch the piriformis muscle. But a curious viewer might ask, what causes the piriformis muscle to shorten? Here, a kind of vicious circle forms, so to speak. Because the piriformis muscle doesn't just shorten for no reason. Very often it shortens due to weakness of the gluteus maximus muscle. And the weaker the gluteus maximus muscle is, the shorter the piriformis becomes. The shorter the piriformis muscle is, the more the inferior gluteal nerve gets pinched, and the more your glutes disappear. But you can't do anything about the gluteal muscles. They tend to be weak, especially if you have a sedentary lifestyle, not an active one, but a sitting lifestyle. If you lie down a lot, they also become flat. If you sit a lot, they also become flat and weak. So, the gluteus medius muscle. Let's start training it. We lie down on our side. We bend the leg that's on the bottom, straighten the top leg, and in this position, we start lifting it. Try to keep your foot parallel to the floor. If you do it like this, part of your gluteus medius muscle will stop working, and the load will shift to the front part, which is usually more or less already developed. That's why we try to keep the foot parallel to the floor. It doesn't matter here whether you point your toes or flex them. Several levels of difficulty. If it was quite painful for you during the massage, and it's hard for you to do this movement, you can start by simply holding it statically. Even at a small height, just to stimulate it a little, even for about 5 seconds. To start, lift it not very high. Many people will already start to get tired from this because the gluteus medius muscle needs to work both dynamically and statically. So, for the first option, turn your leg out. You can even do it just a little so that your heel is pointing upward. And right here, like this. Hold it in this position for 5 or 10 seconds if you can, then put it down and relax on one side. We do this as well. I'm showing it. You need to do it for prevention too. You can do it yourself. And then to the other side. It may be that for some people, on one side it's more developed, and on the other side it's less developed. You can feel the difference between them. Then we move on to doing this exercise dynamically. Here, you lift your leg, try to keep your foot parallel to the floor, your leg in line with your torso, and then lower it. You don't need to lift it too high. Well, about 45 degrees is enough, and then lower it, lift it, lower it, lift it, lower it. If these muscles aren't well trained, after just a few repetitions, you'll already feel a sense of tension right here in the side area. If, while doing this exercise, you feel pain somewhere, then for now, go back to the stage where you work everything out with the ball. From one side to the other. Do it. Lift up, lower down, lift up, lower down. At the top point, you can hold for a second to increase the load. But if it doesn't work out very well, then you don't need to hold at the top. Just lift up and lower down. This is the first exercise. Next is the second one. Now you move your leg a little bit forward, right here. The first time we had it in line with the body, now it's a bit in front. And from this position, you start lifting your leg the same way. And here, you also need to make sure that your foot is always parallel to the floor. Don't turn it out like this. In all the positions where we'll be lifting the leg, the foot should be correct, parallel to the floor. Or you can even lift the heel. This is also from 5 to 10 repetitions. We did it. We lifted to one side and to the other side. We did this movement as well, friends. More exercises, even more detailed ones, are waiting for you at the link in the description. We will cover the hip joints, all other joints, and the spine in detail, breaking everything down thoroughly. And it turns out you even need to learn how to walk correctly so that all these muscles work at the right moment and don't interfere with each other. If something cracks somewhere during the exercise, there's nothing to worry about. But if you feel pain, it means you shouldn't do it at that angle or with that range of motion for now. Only do what you can without pain. But your muscles may get tired, that's normal. As soon as it gets tired, stop, rest, or do it on the other side. We had a second position and a third one. Here you move your leg back, just a little bit back, and in this position you also lift it. Also, try to keep your foot from turning out like this so that it's parallel to the floor, or you can even lift your heel up a little. Also do 5 to 10 repetitions. For some people, you might get tired even on the third repetition, so for you, 3 repetitions will be enough for now. With weakness in the gluteus medius muscle, the side muscles often get involved as well. Here, the quadratus lumborum muscle, for example, and in this case the pelvis, starts to lift up. But at first, if this happens, it's nothing to worry about. Later, as the muscles get stronger, the pelvis will move less. And finally, here's the third position, where along with the gluteus medius muscle, the gluteus maximus muscle will also be working. This is when you bend your legs, bring your knees together, and from this position you start lifting your leg up. And while doing this, try to make sure that your pelvis doesn't rotate backward like this, so that the movement is correct. Only due to the movement in the hip joint, but the range of motion may be small. However, the exact muscle that needs to work will be engaged as well. To one side, then to the other side. Let's do it. So, the third option is a bit easier compared to the previous two. Also, just in case, you can try stretching the piriformis muscle. There are different ways to do it, and one of them can be done while sitting. Not everyone will be able to do it, especially those who already have stage 2 or higher joint arthrosis. Maybe it won't work for them anymore, but it's worth trying. You can. This is more for prevention for those who don't have arthrosis yet, for those who still have a piriformis muscle. It's better to work it out with a small ball. You place your leg like this. For some people, the shin won't be parallel to the floor, and that's okay, you just need to do it as you can. To start, place your leg on your knee, press down with both hands or with one hand, and in this way, kind of push the knee down. If your leg is already more or less parallel to the floor, you start to lean forward. Here, you should try to lean forward with a straight back. You can also lean forward by bending your lower back, but if you try to lean forward with a straight back, that's when you'll really feel your piriformis muscle stretching. Right in this area, here in the gluteal region, you should feel a stretch. Even if your range of motion is small, you'll still feel something pulling somewhere in your glute area. This is one of the ways to stretch the piriformis muscle. There are also different ways. You can do it lying down, but not very much. This one is comfortable, like this. So you put your leg here, grab your thigh, and pull your leg towards yourself like this. And this will also stretch here in the back. In the area of the piriformis muscle, if you can't reach with your hands, you can use a strap or a belt. Pull it towards yourself, and in this way your piriformis muscle will also be stretched. But this is basically the same as this position with a forward bend, only now you're lying down when you pull your leg. Well, my friends, congratulations on finishing your journey through the hip joint area. Those of you who did the exercise, write in the comments what worked for you, what didn't, what your results are, what your impressions are, and what you expect from the next episodes.